ANCASAM is the proven solution for software to streamline critical operations for home and community-based service programs. We focus on simplifying and automating the complex workflows that we know are part of managing Medicaid programs. As a result, our clients see increased efficiencies and accuracy in their day-to-day work and make room for continued growth in their programs. ANCASAM is proud to be a leader in software for Medicaid billing and adult foster care programs in Massachusetts, and we'd love to talk with you about how we can help.
This presentation has been approved by the American Nurses Association of Massachusetts, an accredited approver by the American Nurses Credentialing Center Commission on Accreditation. Successful completion is judged by writing your name in the chat located on your Zoom toolbar and responding to the post survey within 7 to 10 days. Each participant will receive surveys via DocuSign by end of business today. There has been no conflict of interest identified for this presentation.
Good afternoon, everyone, and welcome to the 5th Annual AFC Summit, proudly hosted by Nonotuck Resource Associates in the AFC Roundtables. This year marks the second year of the AFC Summit having gone virtual through the development of this webinar series. Although virtual, the mission of the AFC Summit remains to provide an opportunity for AFC provider agencies to learn from one another, to share information and resources through networking, and to continue the ongoing dialogue between organizations through the statewide AFC Roundtable groups. These groups will return to a regular meeting schedule beginning July 2021 in a virtual format. Today, you'll have two moderators, myself, Deb Schneer, and Carrie Parody, who will assist with Q&A. A few brief instructions for participants. All participants have entered today's webinar muted and with their cameras turned off. We ask out of respect to your presenter that you do not turn your cameras on or unmute unless directed by the moderators during the Q&A. Please submit your questions to the presenter through the chat located on your Zoom toolbar. The presenter will respond to your questions at the end of his presentation. Without further delay, we'd like to introduce today's presenter, Pete Hathaway, Managing Director of Employment and Community Services for CARF International. Welcome.
Thanks, Deb. It's a pleasure to be meeting with you today. I'm going to talk about standards changes for the first part of this presentation. As luck would have it, there's been relatively few changes in the standards from 2020 in the 2020 and 2021 manual. It wasn't because we somehow had some insight into the fact that there would be a global pandemic. The significant changes, and we're going to talk about those in 2020, were the standards around performance measurement and management performance improvement. Significant changes, the requirement of a now 6th plan to go with the other 5 that were already in place. So we'll talk a bit about that. The 2021 standards change. We had queued up the health and safety standards as the area for review and probably a big overhaul. As we always do, we sent out some feelers, some inquiries with some experts in that area. And the feedback we got was, in health and safety, not a lot of changes. So they felt like our standards were pretty good. So we're still representing best practices. So didn't have the big revision there that we typically would. I suspect 2022 will be an area where we have some significant Section 1 changes again. So with that, let's go ahead and get started with those changes in the standards that we just talked about. I have a few questions that were sent in previous to today, and I will answer those at the end of this part of the presentation. And one question related to the digitally enabled site or DES surveys that we're currently conducting, the virtual surveys. That'll be the second part of the presentation, and I'll answer that question and any you submit at that point. So in Section 1A leadership, there was a change there, and this was in 2020. Standard 1A3 says that the identified leadership guides the element K, ongoing review of the organization's policies in accordance with the organization's needs. This standard became less prescriptive. Previous to 2020, the standard said that The organization reviewed all of its policies on an Okay, I was muted there temporarily, I believe. The standard now says that the organization determines the frequency with which it will review its policies. So what you can't do is wait till the surveyors show up and say, well, we last reviewed them in 2018, so I guess that makes our interval 4 years. And you have to have some forethought and purpose with that, but you now determine the frequency with which you will review your organizational policies. All right, in section 1C, strategic planning, standard 1 says that the strategic planning of the organization considers, and previous to this, element C said service area needs. That's been replaced with social determinants of health, which has become a buzzword, I guess, as of late in the last few years. You hear a lot more about it. Certainly, as you look at things like who suffered worst statistically from the pandemic, from COVID-19, and who is most likely to get it or experience long-term effects, you begin to understand just how relevant social determinants of health are. And there are certainly determinants of health that impact service delivery and access to services and those sorts of things. So just be aware of that change in your strategic planning. The replacement of element G, service area needs, now replaced with social determinants of health. All right, in finance, you'll see a change that appears several places, and I didn't add every one of them because it's the same change over and over again. But standard 4 says the organization, when you have to review your processes, you'll see the elements added that you identify areas needing improvement and implement actions to address those improvements needed. So do be aware of that change. It occurs in a number of standards. I didn't identify it in every one because it's the exact same change over and over again. But as you probably already know, at the beginning of your standards manual, it will identify any changes in the standards manual for that standards manual year. So you can always go back there and find that, but you're responsible for the changes that occur in the standards from the standards manual year in which they occurred. So it's important to stay on top of those things. All right, this is in red, and that is because we removed the standard. This standard 1F5 appeared in the standards manual for only 1 year. I believe it came in 2020. It's coming out in 2021. Not that this isn't important. The standard says, standard 5 in finance says it. The organization would conduct an analysis annually of its financial results, and you're considering trends, areas needing improvement, actions needed to address improvements, implementation of the actions, and whether the actions taken accomplish the intended results. The reason that we took the standard out isn't that this isn't important. It's that our experience is that organization, that those of us at CARF have ever worked for or at, does this already. So in some cases, it was causing organizations to go out of their way to document that they actually did it. We believe that every organization, if there's anything they do, they review their financial results as you're planning for your subsequent year's budgeting. So standard 5 has come out of the standards manual for 2021, and so you can count that as a small victory. All right. A change that occurred in section H, health and safety, that's pretty relevant. I actually think this one came in 2019, but I wanted to bring it up because more and more services are being provided in the community, and AFC providers are a good example of that. So previously, our standards focused a lot on services provided at facilities and the health and safety of personnel at those facilities, in addition to the health and safety of persons served. This standard says that if an organization provides services in locations that are not owned, leased, or controlled or operated by the organization, it implements written procedures that address safety of persons served at the delivery site. So for both persons served and personnel, you're going to come up with written procedures to address safety. And then continuing on, it considers any emergency procedures that may already be in place at the service delivery site, the physical environment, including accessibility of the delivery site, the basic needs in the event of an emergency, actions to be taken in the event of an emergency, and provisions for communication by personnel while providing services regarding decisions to continue or discontinue. So for many of you that are being accredited for adult foster care, I would guess that you already have procedures in place regarding safety of the person served at the foster home, but make sure you have all of that documented, and surveyors will be asking you about that. If those of you that might have other programs accredited, like community integration or employment programs, clearly that would need to be addressed. It probably already is, but this was probably long. More and more we're seeing services provided in community settings and not in settings that are owned or controlled or leased by the organization. So pretty relevant standard there. Still in health and safety, standard 12, the addition of written procedures regarding infectious and communicable diseases, that was added again without any knowledge of a pending global pandemic. But boy, is this standard ever become relevant? And one of the questions that we had relates to that was submitted before the today asked about this very thing, and we'll talk more about that at the end. But you implement written procedures regarding infectious and communicable diseases. All right, in workforce development and management, previously human resources, standard 7 workforce development activities include the documentation of competencies for your personnel, the documentation of the assessment of those competencies, and then timeframes and frequencies related to competency assessment process. So you're identifying the competencies that people at various positions within your organization need. You develop a means of assessing those competencies, and then you document the timeframes related to completing that assessment of competencies. So do be aware of the change in standard 7 in workforce development, which is the old human resource standards. All right, in technology, we've added just element 6 to standard 1. It says you identify gaps and opportunities in the use of technology. Leadership supports the ongoing assessment of, probably an oversight that it wasn't in there earlier, but your use of assistive technology. Assistive technology became particularly relevant during the pandemic. We'll talk more about that when we address the questions at the end of the changes in standards section, but just be aware of that new element as you're developing your technology plan, that you're including the assessment of assistive technology for person served. Still in technology, I remember standards, I think it's 6 through 11, apply when you're providing services through the use of technology, which many organizations had to resort to as a result of the pandemic. So a lot of services began being provided virtually in areas that we never anticipated seeing or didn't anticipate seeing this quickly. This particular element to standard 7 indicates that or requires that personnel received documented competency-based training on the equipment that you might be using to provide services through the use of technology. All right, this is the major change, and this was in 2020, and really want you to pay close attention to this. This is a big change. Performance measurement and management and performance improvement, as you probably recall, these are the standards that require that you develop measures of effectiveness, efficiency, service access, and satisfaction and feedback for persons served and personnel. That part hasn't changed. For each program of service, like adult foster care, that you have accredited, you have to have at least one measure of effectiveness, at least one measure of efficiency, one of service access, and at least one of satisfaction for both persons served and other stakeholders as you've identified. The big change is that in the way that you evaluate or assess your results, but the biggest change is that you now develop a plan related to performance measurement and management that articulates exactly all of the details of your performance measurement and management and performance improvement processes. So you're going to describe, for example, how you're going to ensure the reliability and the validity and the completeness and the accuracy of your data. how and by when you will have evaluated your data, how you're going to share that data, and by when will you share that data and in what format. So make sure you're paying close attention to that. Some pretty big changes. Some other ones that you'll see when you review this is that, for example, now influencing factors or extenuating factors used to be identified in Section N as you did the evaluation. They're now moved to Section M. Remember that the standards mirror the standards in M. So not that we encourage you to count recommendations in your survey report, but if you were to miss the sections or the standards, in Section 1M, performance measurement and management, you're going to miss those same standards as they appear in N when you do the evaluation of your results. So it's a great way to rack up a lot of recommendations in a hurry. Pay close attention to that because this standard was new in the 2020 standards manual. It's our expectation that you will have implemented this plan by the end of the 2020 standards manual year, which is June 30th. So if you haven't developed a plan yet, you'd have about a month and a half to get that done. Again, the expectation is that when standards change, you've adjusted to those changes in the standards manual year in which they occurred. And if they occurred in the year in which you're being accredited, you absolutely have to have implemented those changes by the time of your survey. So be aware of that. A fixed plan. So remember, we have the plan on cultural competency and diversity and leadership. We have strategic plan. We require a technology plan, an accessibility plan, a risk management plan, now the performance measurement and management plan. So this is where the work is, I think, for most organizations in terms of adjusting to standards in 2020. We didn't have that big change for 2021, so maybe gives you more time to focus on this. All right, now moving on to changes in Section 2 of the Standards Manual. In Section 2B, this is the standards around the individual-centered service plan design and delivery. Standard 4 has been modified, so as follows. As appropriate to the person served and the scope of service provided, the following information is considered for service planning. We've added relevant functional information. This standard is the one that also says that you'll consider relevant medical, psychological, social history of the person served. So we've added relevant functional information to that standard as well. All right, this is particularly relevant to most of you, although your Mass Health already requires that you do monitoring visits at a more frequent rate than CARF does, but I'll go ahead and go through this and we'll talk a little bit more about it. For host family shared living, which is what you call adult foster care, the organization implements, or was what we call adult foster care, the organization implements a procedure for monitoring the performance expectation of the host family shared living provider that takes place quarterly after the initial 30 days, unless the individual situation merits more often. Previously, it was every 6 months. In checking in with Mass Health yesterday, you're required to do that, I believe, monthly now. And so this won't impact you. If you weren't doing it on a monthly basis, you might expect a recommendation from CARF in our Section 1E legal standards, because in Section 1E, we say that the organization will comply with all state, county, regional regulatory requirements. So the way CARF treats these sorts of things, if your regulators, their expectations exceed what our standards say, then that's the bar you have to meet. And if our expectations exceed your state regulations or your county or whatever your regulations are, then you have to meet that one. So you're always meeting the higher bar. So for example, when we identify critical incidents, if the list of critical incidents that your standards you report on does not include all the elements that CARF does, then we expect that you meet both your state or regulatory requirements and ours. So do be aware of this change, but you should already be meeting this standard by virtue of the fact that you're required to do these monitoring visits monthly. I don't know if many or any of you get accredited in home and community services, but if you do, there was a change in standard 6A. The risk assessment for persons served documents the following areas. So we already asked that people were assessed in behavioral, cognitive, communication, developmental, emotional, environmental, physical capabilities of the family and support system. But now we're asking that that assessment be documented. So that is the end of the standards, the changes in the standards. I'm going to address some of the questions that were submitted to us previous to this training. And then if you want to ask additional questions, this would be the time to enter them into the chat. So the first question was a very good one. It says, have standards changed because of COVID-19? No, they haven't, but we already had standards and we looked at one of them already, the standard around communicable diseases. So you can really expect that your survey team will look at the standards you have in place regarding infectious and communicable diseases, any changes that you made, and almost certainly you did make changes in your policies around communicable diseases as a result of the pandemic. You would want to be showing that to the survey team. The other area that was impacted, not necessarily changed, was back in technology. As I mentioned earlier, standards 6 through 11, I believe it is, apply when the organization uses technology to provide services. Well, many, if not most of the organizations we accredit, especially early in the lockdown, and to some extent to this day, are now providing services virtually to some extent or another, whether it be the monitoring visits or whatever it is. So if that was your situation, that you began providing services virtually for some part of the tenure of your existing accreditation, the survey team will expect that you've been meeting standards 6 through 11 during that time period in which you were providing services virtually, even if you resume to face-to-face services at some point, because at parts of the tenure of your accreditation, so the time between your last survey and your next survey, you began providing services virtually. The expectation is that during the period, you were meeting those standards 6 through 11. The next question that we had was, how will telehealth visits be evaluated versus in person? Well, again, back to those standards, they apply. I mean, we treat them the same way. You should be documenting the results of those visits. You should be ensuring confidentiality. We do that as services. Most of the areas where we accredit in most of the states and provinces and with the Veterans Administration, because of the pandemic, virtual visits were treated like in-person visits, and they count and you're able to bill for them. We would treat them just like a in-person visit. Okay, the next question was, is reaccreditation the same as the first time, or do you concentrate on specific areas? Well, no, we still apply all the standards that we would have applied in the original survey. And any standards that have changed will be applied, of course, with the expectation is that you're meeting the changes, the standards, any changes since the year in which that change occurred. Something to look for, though, I think something that you should pay attention to in a subsequent survey is if you had any recommendations, and the overwhelming, almost all organizations that we accredit have recommendations. Recommendations aren't a bad thing, but you submitted a quality improvement plan that identifies what you're going to do to come into conformance with any standards that you might have missed in your previous survey. Make sure you've addressed those things. What you don't want to have happen is that on your subsequent survey, you have recommendations that start off by saying, as recommended in the previous survey, blah, 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 which then implies that you didn't correct the areas that you indicated you would correct. So make sure that you fix the things that you said you'd fix. Typically, organizations get more recommendations on their original survey than they do on subsequent surveys. You don't want to have a lot of those as previously recommended comments or recommendations that appear, especially in the area of health and safety, but if there are several of those, what it begins to do is erode the survey team's confidence in your commitment to quality improvement. Now, occasionally, an organization will say that, we're just not going to meet a particular standard. We think that it just doesn't fit with our service delivery model, excuse me, and so we're going to knowingly choose to get a recommendation, and that's fine. You can do that. Any one recommendation in and by itself isn't likely to cost you your accreditation. It's an on-balance decision in terms of the accreditation decision. You can't have several of those, but if you are going to knowingly just not meet a standard, just say that in your quality improvement plan. So don't make up a strategy to come into conformance with the standard, knowing that you're not going to do that. If you're going to take that route and say this particular standard, we're going to choose not to meet, say that in your quality improvement plan. You shouldn't do that many times, but certainly once or twice in a survey of all the standards, that's not going to be a deal breaker for anybody. But just be clear on that so that you're not telling us that you're going to do something that you have no intention of doing. The next question was, will there be additional training or documentation requirements that we'd be looking for regarding COVID-19? Well, no, other than some of the things we've already discussed. If you were providing standards through the use of technology, then those standards 6 through 11 come into play where they previously probably wouldn't have. Also, we're going to be looking carefully to see that you followed the standard around communicable diseases. And also, there's a standard around the continuation of essential services and health and safety. For many organizations, that was likely impacted. And in adult foster care, I can't imagine that you discontinued services, but you might have changed the way you provided your supports, maybe the way you did your monitoring visits. So those are some areas that I'd be looking at. Do we anticipate changes in our standards as a result of the pandemic? Maybe some changes in terms of the technology standards and when organizations are using technology to provide support. Originally, those standards were probably designed more with telehealth or teletherapy in mind. And because of the pandemic, organizations started providing a lot of services through the use of technology, and not necessarily things that were as clinically based as telehealth or teletherapy. So I wouldn't be surprised if we see some changes there, possibly some changes in terms of communicable diseases just to bolster those, but we had those things in place already. So if organizations were meeting those, we would expect that probably they had to modify their policies or procedures in those areas. The next question is, does CARF have a requirement for how long documentation must be maintained in a member's records? We don't. We certainly expect that you, in terms of documentation of conformance to standards, for those standards that require some sort of written documentation, obviously you'd need to go at least back to your last survey. So if you got a 3-year accreditation outcome, at least 3 years. But again, going back to that standard that I talked about earlier in legal, where it says you're conforming to all of your state, provincial, county regulatory requirements, we would expect that you're keeping your documents, the longevity would in sync with what your state requires. So if they say 7 years or 6 years, that would be our expectation. And the next one, the last question that was submitted prior to the presentation was, are there any trends noted to the biggest changes for organizations going? So again, the second accreditation question, I realize many of you got accredited for the first time. No, I wouldn't say that there are a lot of changes or trends that we see on second surveys. We expect to see progress. We expect to see improvement over the first survey, and typically we do see that. Because the first survey, as much as you can talk about and prepare until you've actually been through a survey, it's conceptual. You have your first survey, you get a sense of exactly what the surveyors are looking for and how they're going to conduct their survey. The exception, of course, being the digital survey that we're going to talk about next. But just make sure that you've addressed the issues and that you've stayed on top of any changes in the standards. Note that, as much as we would like to have 100% inter-rater reliability amongst our surveyors, we don't. So occasionally a second survey team comes in and they see things a little bit differently than the first one. So just kind of be prepared for that. But if you've maintained all the systems that you set up for that original survey, then a lot of your second survey and all subsequent surveys are simply showing the surveyors what you've been doing since your last survey. So begin to prepare for what you're going to show to the surveyors. Begin to think about who you want them to talk to, who is it that at your organization or stakeholders that will be able to communicate your conformance to the standards since your previous survey. Remember, on a subsequent survey, it's not just the last 6 months. On an original survey, you need to show conformance to the standards for 6 months prior to your survey. But these resurveys, the expectation is that you can demonstrate conformance to the standards since your last survey. All right, moderators, were there any questions submitted regarding changes to the standards?
We don't have any questions right now, Pete.
All right, then let's go on to the digitally enabled site survey. So, about February of 2020, we realized that things were changing rapidly, that flights were stopping and in-person surveys were no longer going to be possible. So we developed pretty rapidly the DES, or digitally enabled site surveys. And those were, and up till now still are, being conducted in place of in-person surveys. So we use MS Teams as a platform. We will be interviewing person served, just like we did in a in-person survey. We'll be interviewing personnel, and generally the same personnel as we would. Other stakeholders that you've identified for your accredited program are also people that we will interview. We're going to look at the same documents. So, we're going to look at your policies, your procedures, those standards identified in Appendix A in the back of the manual that required some sort of written documentation. We'll be expecting to see those. Organizations that already had all of their documents in a digital format have an easier time of uploading everything into MS Teams. You'll be able to ask, if you have any questions about how to do that or are struggling with that, there are resources available from CARF to help you get that done. But the expectation is that all the documents we looked at before, we're going to look at them. We're going to interview the same people. We're going to be doing tours of your facilities like we did before. So a digital tour, so we take a device, a phone or an iPad. The feedback I got, especially originally, was that sometimes on the tour, we saw a lot of the ceiling and a lot of the camera holder's shoes, but I think people have gotten better at that. So for any property that you own, control, lease, we're going to see. So your administrative facilities, if you're an adult foster care provider, we wouldn't be going to all of the adult foster care homes because those are properties that you control. Now, we're probably going to be interviewing people in those locations, so we would see some of that, but those aren't your properties, so we wouldn't be expecting tours of all of those. We still use our same surveyors to do the DES surveys, so they're our same seasoned cadre. As you might expect, out of our 1,400 surveyors, some really took to the DES surveys. They really enjoy them, but I got to say the majority don't. They've done them to help CARF out, but most of our surveyors are very excited to get back out in person. They became surveyors because they want to go look at organizations, meet with people at the organization, interview the personnel and person served at those. So we just did a survey of our surveyors, and overwhelmingly the results were, this is okay, glad to fill in, but we really want to get back. Some of the discussion is they feel like some of the interviews aren't as effective, especially with person served. Interviewing through a device doesn't always result in as good an information. And as a prior surveyor myself, some of the best interviews you have are those things that happen spontaneously. The other area that I understand is a little bit troublesome is that sometimes if documents are hard to find, you're not finding exactly what you need. It's more difficult to do that virtually than it is when you're in person, and you can just say, show me in your procedures manual or show me in your digital policy manual exactly where this is. So there's been some issues there. Surveyors reported some significant screen fatigue. The other issue that sometimes is a little bit troubling is if you have a survey on the East Coast, Massachusetts, for example, and one of your surveyors is from California, that's or Washington or Oregon or British Columbia, that's quite a difference time zone wise. So that 8 o'clock survey start time would be 5 o'clock for them. So not as bad as the survey that we had to do digitally in Saudi Arabia, where our surveyor literally worked in the middle of the night and reported being quite exhausted by the time they were done with 3 days of that because they weren't getting much sleep. Let's see. I guess that's it for those. We had one question submitted regarding digital surveys, and it's a good one that says we are scheduled to have a CARF survey this summer. Will it be in person or virtually with the agency, with the person served? So in terms of who it's with, I think we've already answered that question. It'll be the same people that were involved in your in-person survey. We need to talk to some person served. We're going to want to talk to some personnel. In terms of how long we'll continue to do digital surveys, at this point, we will begin to transition to in-person surveys in the September-October timeframe. So if the 2-month timeframe for your survey is June, July, or July, August, or even August, September, then yours will absolutely be a digital survey. Starting in the September, October timeframe, you will have the option of having a digital or an in-person survey. Now that option will continue, but for how long, I don't know. Our expectation is that we get back to in-person surveys. Many of the states and regulators that require accreditation have been really understanding of the need to do these things digitally. They've done a lot of their own monitoring digitally, but the expectation is that we have people on the ground seeing things in real time, and that's our expectation too. Exactly when we'll transition to all in-person surveys has not yet been determined. We're monitoring things across the U.S. and Canada and our other places around the country to see when it's safe and to travel and those sorts of things. But at this point, it'll be optional for a as of yet undetermined period of time. All right. Are any questions on the digitally enabled or desk survey?
We don't have any yet.
Well, I've kind of run out of material here. I would juggle for you. I guess I could do that. It would show up virtually, but I'd probably end up spilling something, so I'll spare you that. Think of anything else that, yes, go ahead.
You have one, so could you go over the performance management plan changes again?
Sure, and the reason I didn't include every single one of them is because you're really going to need to go to your manual to do that. But the most important part, I would say, that the thing that you've already done hasn't changed. You'll still need to have your measures for the effectiveness of your services, the efficiency, satisfaction, and service access. What's changed is you have to develop a plan that articulates how you're going to gather all this information, how you're going to ensure that your data is being gathered in a way that is reliable, that you're actually gathering your questions, answer the questions you think they will. Is it accurate? Is it complete? Who are you going to share the data with? Timeframes for by when you will have completed the analysis. How you're going to ensure that you initiate areas, an improvement plan for areas that you determine that you need to improve upon. So it really just causes you to articulate that. And one of the reasons for this change is, and we've seen this happen over and over and over again, if at an organization, one person is responsible for the performance measurement and management system, and that person hasn't shared that information, there aren't others cross-trained. When that person leaves the organization, oftentimes all of that institutional knowledge walks out the door with them, and nobody else knows how to continue to the methodology involved in continuing the performance measurement and management performance improvement system that the organization has. This plan will cause you to articulate all of those things, and so that if that person who has responsibility for performance measurement and management leaves, you've got a written record of exactly how you ensure, again, reliability, validity, accuracy, completeness, how you gather information, who you share it with, the timelines for sharing that information, how you'll initiate your performance improvement activities and monitor those to see if they've been effective.
So I think Pete will give it another couple of minutes as people sift through the information and maybe formulate some questions. There was a lot reviewed today.
And we recognize that we haven't been able to get out and do the typical trainings that we do around accreditation and changes and those sorts of things for either new organizations or organizations that just want a refresher. We did do a few digital trainings, but any of you that have ever been to a CARF 101 or even the one-day trainings we did in Massachusetts in 2018 or 19, really difficult to do in a digital format. I've done a few of them. It's hard enough to keep people's attention when you're sitting in person and you can go up and tap on their table to make sure they're still awake. Doing it virtually, it just doesn't transition very well. We've done some shorter digital trainings. We're in the process of recording some trainings that will be available, very short targeted trainings for organizations. But we are also in the process of beginning to, in fact, we hope in July, August, September, to begin to resume in-person trainings. We're looking at training on the East Coast, probably Florida, and a CARF 101 training, another one in the West, maybe Tucson, maybe Las Vegas. And we anticipate, based on the number of inquiries that we've had, that those will probably fill up pretty quickly. If there's time left in the year, we'll continue to do a few more as the year rolls out.
Pete, I just take me a second to read all this. If our program has not significantly increased the number of persons served since our accreditation, is it likely we would have a similar survey, i.e. we had one surveyor for 3 days? Would we likely have the same or have 2 surveyors for 2 days?
You're likely to have the same. The only, because of, if you're only getting adult foster care accredited, you only have one location that we have to visit. Where surveys tend to get big is if it's a statewide program with lots of locations we have to see, or if an organization has multiple programs of service accredited, those tend to become bigger surveys. But if as you stated, you're doing the same service, you haven't added any locations, and your survey team, so our surveyors give us feedback at the end of the survey, just as you do. And one of the things we say was there enough surveyor days? So if that one surveyor that did your survey said, this was reasonable, I could accomplish all I needed to in the 3 days I had, then it's quite likely that you would have the same survey size as before. There's always the potential for that to change. Typically, it's either determined by the feedback we got from the surveyor or something has changed at the organization.
Thank you.
We'd also like to just remind folks that are with us today to enter your name in the chat room, particularly if you're interested in contact hours, which this webinar is approved for. Any last questions for Pete today?
Well, as people opt to or not to ask any more questions, here's contact information. I'm available at phathaway@carf.org. Ron Tran, who is the resource specialist who works with organizations in Massachusetts. I'm sure many of you know Ron. He's available at rtran@carf.org. I do happen to know that Ron is, I think, taking a well-deserved vacation. And so if you contacted him, you might not hear back until, I think, next week is when he returns. But either one of us are happy to answer any questions you have that you didn't ask here. As you begin to prepare for your digital survey, if that's what you're going to have, there's typically a lot of questions that come with that, and Ron and the other resource specialists and other staff at CARF have become very adept at walking organizations through the preparation for a digital survey.
Great, I think that's helpful. Some feedback coming through the chat, Pete, that this was very helpful information for folks. They're really appreciative of your time today. So we'd also very much like to thank you, Pete, for joining us this year for the summit. Hopefully next year in person. That's what we're all hoping for. We'd also like to thank again our sponsor for today, ANCASAM. And we hope we see everybody back tomorrow morning for Moving Forward an AFC Status Update with Mass Health, presented by Allison Ananis, Sherry Hannigan, and Linda Chor. We hope everybody has a great day. Thank you so much, Pete.
Thank you.
Thank you, Pete.
Thank you.